all for attending. Sorry for the technology delays. My name is Aryelle Blair. I'm a physical therapist in our outpatient neuro rehab department. I currently work at Martha Morehouse and get to work with a lot of our individuals with various neuromuscular disorders and collaborate with Andrea to help provide the best care for these individuals.
And my name is Andrea Jaworek, and I am a research physical therapist for the Division of Neuromuscular Disorders through Neurology at OSU. And I currently provide PT consults through at MDA and ALS clinic. And then I'm also a clinical evaluator that performs physical outcome assessments for drug trials and clinical readiness trials and natural history trials. And then I also provide like one-time aquatic visits for patients to learn a home exercise program.
So we're presenting today on exercise and neuromuscular disorders. Our objectives for today's presentation are to define neuromuscular disorders and identify symptoms, identify the multidisciplinary team who's involved in treatment, examine appropriate exercise parameters for individuals with neuromuscular disorders, identify certain types of exercises and activities that are beneficial, review appropriate tests and measures for assessment, and then list quality of life and patient-reported outcome measures that would be useful. So what are neuromuscular disorders? It's important to note that this really is an umbrella term that encompasses a wide variety of different diagnoses. So it encompasses diseases that affect the motor neuron, the muscle, the neuromuscular junction, and the peripheral nerve. Because it is such a wide umbrella term, there is a little bit of differences in presentation and just disease progression amongst the different diagnoses. So for our presentation today, we're sort of making more general recommendations just across that NMD spectrum, but there might be some more specific recommendations within your diagnosis. So it's always important to defer back to your neurologist or referring provider or physical therapist about the best tailored program. So not going to read through this whole slide because it's very wordy, but these are just some examples of what types of diagnoses are considered these neuromuscular disorders. So for motor neurons, some common ones would be amyotrophic lateral sclerosis or ALS, spinal muscular atrophy, post-polio. For our neuromuscular junction disorders, we have myasthenia gravis and Lambert-Eaton. For muscle disorders, we have all of our muscular dystrophies, our inflammatory muscle diseases, our inclusion body myositis, and peripheral nerve is any idiopathic or hereditary peripheral neuropathy, Charcot-Marie tooth, any kind of chemo or drug-induced neuropathy. So a whole host of diagnoses that are within this umbrella term. This slide was not something that was referenced from a specific study, but Andrea and I sort of created it just to show that with all of the neuromuscular disorders, or the majority of them, we do expect to see disease progression over time. So the x-axis, we've got disease progression, the y-axis is disease progression, the x-axis, we have time, which could be months or years, depending on that diagnosis. Without exercise, we do expect to see a disease progression and change in symptoms over time. With exercise, our goal is not to cure disease, not to reverse any changes, and not to completely prevent your decline in function, but the goal is that that progression can be slowed over time. So that is the main goal with exercise that we just want to set a precedent for.
So what my patients with neuromuscular disorders report, so their symptoms, we hear a lot about fatigue, and overall we're kind of providing like energy conservation like parameters. So how can they go about their regular day? So we provide like how to make your activities of daily living a little bit easier for you so that you can do the activities that you actually want to do, like with your family and your friends. We hear about muscle soreness a lot. Cramping can be in multiple muscles, muscle tightness, and that's where we can come into play to help go over like range of motion and stretching. We hear about frequent falls. One thing I want to report about this for the fire departments here in Columbus, they will actually go in and install grab bars for free in your home. So that's a good thing to utilize here in Columbus. We hear about tripping or dragging of the feet, and that's where we are assessing like your manual muscle testing, scoring your ankle and seeing if an AFO, like an ankle foot orthosis, is warranted. You might have trouble reaching overhead. A lot of people will report that they cannot do their hair when standing up or sitting anymore, and they have to lay down on their back to do their hair. they have trouble getting up out of a chair or like a low sofa, trouble getting up from the floor, and we can help with that, work on different techniques to where you might actually be able to do it on your own or with the help of a caregiver. Trouble going up or down the stairs, difficulties with walking or balance, and back pain or other joint pain. So medical treatments, I'll just briefly touch on this. There's oral medications for symptom management. As Aryelle expressed, most conditions do not have a cure. Leading to the next point, we're always working on that in clinical trials. So we have various ones here at OSU and across the country for various conditions and diseases. Jerry is our respiratory therapist here, and so he'll work in conjunction with our neurologists and nurse practitioners to see if you need like supplemental oxygen or BiPAP, CPAP. And we have an infusion suite here as well, which is another way of receiving a medication. Okay, so overall our treatment team, if you've been to MD or ALS clinic, you've probably seen multiple different providers on this list. I will not go into all of it because you all came to learn about exercise. So you can see, you know, from the neurologist to the OTs, as Aryelle and I will dive in deep to PT. You have wheelchair seating clinic, a genetic counselor, you know, Jerry, an orthotist, look at AFOs or any other back or neck braces. Outpatient rehab has rehabilitation, psychology, social worker. So you have different avenues to help with different plans of care for you. And Aryelle's going to talk about exercise fit parameters.
Yeah, so we'll kind of dive into the different modalities of exercise and look at the frequency, intensity, time, and type recommendations for each of these exercise modalities. A lot of these parameters were taken from the American Heart Association recommendations for just general adults, and then we've tailored them specifically to our clientele with neuromuscular disorders. So the kind of big takeaways is just really looking at that intensity piece and how we modify that. So aerobic conditioning, really anything that's getting your heart rate up. We recommend a frequency of 3 to 5 times per week and trying to stick with that low to moderate intensity zone. I will show a chart in a couple slides, just how you might monitor that proper intensity zone. The goal is up to 150 minutes per week. That's our general recommendation just for all adults to try to help prevent cardiac disease and some of our other just kind of secondary complications or things that occur with aging. It's important to note that this 150 minutes might need to be broken up more for someone with a neuromuscular disorder. So it might not be that 30 minutes 5 times a week, which seems to be a general broad recommendation. You might have to do chunks of 10 minutes at a time to monitor that fatigue. So don't focus so much on the time component and really focus more on that intensity component. Type, there's a lot of different ways we can achieve aerobic conditioning. We'll talk about it a little bit more on some slides, but swimming, biking, walking would be all options for aerobic conditioning. The next modality is stretching. Stretching can be done daily. There's not really a harm to overstretching. You do want to stick with that low to moderate intensity. So when you start to feel a stretch in a muscle, hold it there in that position. Should be a little bit uncomfortable, but don't really push beyond that. There should not be any sort of sharp pain that occurs with stretching. You want to hold each muscle group for 30 to 60 seconds per group. You want to stretch just kind of in general muscles that you're using for your aerobic conditioning and strengthening programs. There might be some disease-specific muscle groups that are more prone to getting tight. So again, just that deferring to your neurologist or physical therapist for specific recommendations. And that can include active stretching, which you do as yourself, and then passive stretching, which would be caregiver supported. This also includes joint range of motion. The next exercise modality is strength training. So recommendation for frequency would be choosing 8 to 10 exercise that condition the major muscle groups around 2 to 3 days a week. Again, sticking with that low to moderate intensity. So we're not trying to do 1 rep max for our strengthening. For time, looking at 1 to 2 sets of 8 to 12 reps. So a little bit fewer sets and reps than maybe our traditional strength training programs. There is the ability to progress this depending on how you tolerate, but it's good to start with those lower sets and reps. And it should not exceed 60 minutes for a strength training session, and you should be able to still do your daily routine. And then we would recommend prioritizing isometric and concentric strengthening. You can use a variety of equipment to achieve these recommendations. And then last thing is balance training. This recommended frequency is 2 to 3 days per week at a low to moderate intensity, approximately 30 to 60 seconds per exercise, or if you're given a certain number of sets and reps, again, that 1 to 2 sets of 8 to 12 reps. Type could be things that are changing our base of support, eyes closed. We'll kind of get into some specific ideas a little bit later. Last thing I just wanted to highlight is a way in which that in our PT clinic, we would monitor your fatigue levels. So this scale is looking at our rate of perceived exertion, or you might see it abbreviated as RPE. This particular chart is showing on the far left, it's our Borg RPE, something that we use heavy clinically and in research. This is a 6 to 20 scale. The column next to it, so the second from the left column is just a 0 to 10 scale for fatigue. That middle column is describing what you might be feeling with your breathing. And then the second to right column is showing your percentage of your maximum heart rate that you should be working in. So if we're looking at this chart, I've highlighted our target zone in terms of intensity. We really want to be below 70%, 65% of our max heart rate, and no more than a 13 out of 20 on that Borg RPE. So you might feel like your breathing is a little bit more labored, but you should still be able to talk as you exercise. You should never exercise at the intensity where you can't get any words out. That's going to be those higher intensity workouts that are not recommended for NMD. And then Andrea is going to get into some more specific recommendations.
Okay, and so we know that was a lot to try to comprehend. So to sum it all up for you, what is okay? So overall, focusing on low to moderate intensity exercise. So as Aryelle talked about the RPE scale, what levels to focus at, what numbers. We can also gauge this by utilizing the talk test. So we try to say when you're exercising, try to be able to have a conversation when you talk or be able to say a few words. If you can sing, you're probably not doing enough. But if you can't speak at all, you've probably entered that high intensity realm that we really don't want you to be at because you could be over fatiguing your body. For strength training, you can lift light weights and limbs that have full range of motion. So I always give the example of if you're doing like a bicep curl, if you can bring your hand up to your shoulder, then you can go ahead and put a light weight in it if that feels okay, and you can strength train that way. If you couldn't bring your hand up to your shoulder while you're bending your elbow, then we don't want you to place a weight in that because that would be over fatiguing your biceps in that area. You can focus on concentric strengthening or isometrics first, see how your body responds. And like Aryelle had mentioned before, we want you to do a combination of adding in also aerobic training, functional mobility, balance and gait training, and then aquatics. And then overall, what to avoid. We want you to avoid that high intensity exercise realm, muscle soreness lasting longer than 24 hours. We don't want you to have any pain during exercise. Avoid heavy weightlifting. We don't want you to over fatigue the body. So a lot of times I'll tell people if you tried a new exercise routine and you feel exhausted the rest of the day, you can't do things that you usually did, you can't hang out with your family, you had to take a nap, it doesn't mean you did the wrong type of exercise, but it may mean that you did too much of it. So you can try it again, just try to scale it back in duration or sets and reps. And if it happens again, then it might mean you just did the wrong type of exercise, or talk to your PT about it or your athletic trainer. We don't want you exercising 7 days a week. We actually don't want anyone exercising that many days a week, as Aryelle already went over the guidelines. And then eccentric strengthening is kind of a hot topic. We want you to avoid it only for certain diagnoses. Otherwise, this is okay. And we want you to avoid overall high resistance strength training. Okay, so one important point we like to bring up, the 2018 key guidelines for adults with chronic health conditions and adults with disabilities states that adults should engage in regular physical activity and avoid inactivity. So the main point we'd like to make is we want you to avoid inactivity. And the reason is inactivity could lead to more muscle atrophy or weakness. And we try to combat that with exercise. So try to get up and stay active. Okay, so you're probably wondering, what can I do? How do I exercise? So obviously an exercise program is tailored to an individual's like specific needs, but obviously we're trying to address this to everyone. So we're trying to give like some basic examples that anyone can do, and you can tailor it to your own needs. And if you need help, you can reach out to one of us or anyone else that you're working with. So cycling examples, you can do a recumbent bicycle. There's floor pedal bikes that I recommend probably to like 90% of my patients that don't have a regular bike at home or access to a gym. You can do it with arms or your legs, so put it on the floor. use it with your legs, or you can put on the tabletop and use it with your arms. You can get it for about $30 to $50 on Amazon. There's adaptive trikes out there. If you don't need that many bells and whistles, or if you don't want to spend a few thousand, you can buy an adult trike that you can get it for about $300. And you can still find ones with a little bit of back support, but it just puts you in a better position than like a regular locomotion bicycle, easier to get on and off. So you can look into that. There's ellipticals you can use that are great for aerobics, as long as you have the appropriate amount of balance to get on and off and sustain that balance while you're on it. Walking is always great. People underrate it. So if you like to get out, find a hiking path that's paved. I recommend those trekking poles a lot. You can get them on Amazon for about $40. There's also ones that have different tips on the bottom for different terrain, which is really awesome. Walk around the neighborhood with a friend. You can do standing marches. I usually start with the protocol about 30 seconds and do 3 sets of those with rest breaks in between. And then I just tailor that to individual needs. If 30 seconds is too easy or too hard for them. Gardening is another great one. On Amazon, again, there's garden kneelers or garden seats to adjust for people that really like to garden but have trouble getting up and down from the floor or to the ground. Mowing the grass is great if you feel like you can safely do it. And other housework like sweeping, vacuuming, etc. really gets the heart rate up, and it's great. Okay, here's just some pictures. So you can see the floor pedal bikes on the tabletop, and the floor in the bottom left picture are kind of what I was talking about. The adaptive trike, the elliptical, and the right picture is the bilateral trekking poles. Okay, stretching examples. These are typical muscles that tend to get tight in the NMD population. It's not a full encompassing list, so you don't have time to go over it all. So you can kind of see the list here. I'm not going to go through every single one, but these are ones we typically like to focus on because they typically get tight. So things like the biceps, the wrist flexors, the finger flexors, and your fingers start to get tight. The hamstrings, so the back of the thigh, the front of the thigh, the outside of the thigh. Your calves are big ones. I know lots of you have done calf stretches before, pec stretches, your neck muscles, and your lower back. And so the next page just highlights a few of these. The top left one is one of our favorite hamstring stretches because it's an easy position to get into. You can also put your foot on a stool, and then you just are hinging forward at your waist. So it's doesn't typically aggravate your back because you're not like arching your back a long ways, and you don't have to get up and off the ground, anything like that. For the top stretch for your quads, you can actually also use a towel or a sheet to wrap around your ankle and hold with your hand if you feel like you can't reach all the way down to your ankle. But that's a good one to do. And you can actually pull your leg back a little bit further if you want to get the front of your hip for a hip flexor stretch also. And for the doorway one, that's a great pec stretch to do. And even if you feel like you can't raise your arms up that high, you can lower them down a little bit, and that'll still be a good pec stretch. Okay, strengthening. I'm not going to read through all those either. One strengthening thing I really wanted to point out is that obviously it's, we need to tailor it specific to the individual. But I wanted to say that we don't just want to work the muscles that are affected by the disease. Also, depending on how weak or strong they are, as therapists, we kind of make the decision of how much we want to work those. But we also want to work the muscles that are not affected by the disease still, because we want to keep those strong for as long as we can, because your body may really be utilizing those to stay as functional as possible. So that's one point that I wanted to make. And you can look through the arms and legs and the trunk and see all the, like, a lot of the major muscle groups there. And then at the following pages here, you can see some examples of exercises to do, like wall push-ups. You have hand putty that you can use, sit to stand squats, bridges, marches, like we talked about before, because that can go into a strengthening and an aerobic exercise, modified planks. And a lot of these you can adjust to, are you going to do it standing? Are you going to do it sitting if you're in a wheelchair? Okay, so strengthening equipment. You have all your exercises against body weight, so using your own body weight for the resistance. And then you have your resistance bands or dumbbells. Even if you don't have that fancy equipment, you can even use things like soup cans or a water bottle that you have at home, just you can lift that. Also cable columns, if you're familiar with those. And then one other thing I want to point out, if you don't have that full range of motion against gravity, you can always lay on your side and do things in sideline if it's like an gravity eliminated position for a certain muscle group, or you can speak to your PT and say, how do I get in a gravity eliminated position for this muscle? There's strengthening examples here. So you have bridges, you have examples of resistance bands, and that's a good example of how to do a squat that's safe because she's sitting down with a chair behind her in case you get to a point where you feel like you can't get back up. Okay, and Aryelle's going to talk about balance.
So last thing, last kind of modality of exercise is our balance. Our balance, we've got two types. We have static and then dynamic balance. So static, static means that your feet are not moving as you do a certain exercise. Dynamic means that your feet would be moving. So with static balance, it might be anything like with your eyes closed, turning your head while you're standing still, standing with a narrow stance, standing on one leg. Dynamic balance would be something like adding objects in, walking heel to toe, walking sideways, walking on uneven ground. These are just a couple of pictures of some balance ideas. You can see stepping over objects, some head turns, standing heel toe. We do use foam pads a lot of times in our clinic. So that's seen on that far right picture. You can find those on Amazon. You can search Aryx, A-I-R-E-X, that's a brand, or you can just look up like foam balance pad. Just kind of look at what the density is. The more dense, the more challenging it's going to be because it's a higher pad, but that's something you could get for home. The reason that we really want to highlight balance as part of your program is that with our neuromuscular disease population, we do see some impairments in balance. So with balance, we've got three main systems that work together. We have our vestibular system, which is our inner ear and provides information on our awareness in space, our equilibrium. We've got our vision, and then we have our proprioception, which is our sensory input coming in through our joints, through the bottoms of our feet. And all of those three senses, those vestibular, visual, and proprioception, those three systems are all integrated in the brain. So you use your cerebral cortex, which is your higher power brain function, and your cerebellum to integrate that input and coordinate movement. So that way that we have balance reactions. Some really key components to balance are listed here on the left. And then on this next slide, I'm just going to talk about really briefly about why that's really important for neuromuscular disease. So one of the components of balance is our spinal cord. So motor neurons are housed in our spinal cord. So if your motor neurons aren't firing correctly, you're not getting that right input in through your spine. You're not getting that right motor output traveling down through your spine. With our eyes, our vision tends to decline as we age. So that's one of those three balance systems we just can't rely as heavily on. In our ear, again, with peripheral neuropathy, we also see that affect the inner ear nerves, so that one of those three key systems might not work as properly. With muscles, we see weakness in muscles with our different muscle neuromuscular diseases. Signals aren't being sent properly across a neuromuscular junction. And then sensory receptors, so having decreased sensation from a peripheral neuropathy affects how signals get to the brain. And then again, the brain can't do its job if it's not getting that right sensory input. So a lot of these NMD diagnoses, the challenge is that the brain can't do its job because it's not getting all that right input. So really important to have a highly tailored balance program.
Okay, so for those who know me, I'm a big advocate of aquatic exercise. So there was a recent 2022 scoping review article for exercise and NMD. Basically, we just kind of wanted this to have our own couple slides because all of the different areas that Aryelle and I just spoke about, you can do all of those in the pool. So aerobics, strengthening, balance, and stretching. And so I won't read through all of these for time-wise, but you can see all the different things that the pool has been shown to be beneficial for neuromuscular disorders. You can have improved ability to participate in an exercise program, decreased loading on joints, decreased pain levels, improved or sustained muscle strength and range of motion, improved cardiovascular pulmonary health, and exercise tolerance, and so on. So we really like to get people in the pool when they're willing. And you can do a lot more things in the pool sometimes than you can on land, and they have less fear of trying things like different balance exercises because you'd rather, worst case scenario, get your hair wet than fall on the ground. So, okay. It's amazing how many exercises you can actually do with a pool noodle. So even if that's the only piece of equipment you have access to, we're able to show you a lot of exercises that you can do for your whole body. So these are just some examples of exercises, some with a pool noodle and some without. Okay, so how to get started in an exercise program. Start slow, do short durations because you don't know exactly how your body is going to respond, and then you can move up from there. Pick only a couple things to do at first. If we give you a home exercise program, do not do that whole list the first time. See a PT to assist with the home program and get clearance from your physician, especially if you are going to do aquatics. There's exercise apps that can make it a little bit more fun. Make a calendar, set a timer. You're more likely to keep with a program that way. Sign up for silver sneakers or join a gym. Exercise with a friend. They can keep you to make sure you do it, and you can keep them on track as well. There's online exercise classes if you don't have time to get to a gym, and find something you like to do. You're way more likely to actually get started and do it if it's something that you enjoy, because overall you just want to stay active. Okay, I like to throw this in here as well. I won't talk too much about it, but here are some common diagnoses that we see. And I know a lot of these therapists that are on here, they're well known and attributable. So these are just videos or presentations or handouts that you can reference for these different diseases or diagnoses. And they're great resources to have, and they go over different exercises that you can do at home. Okay, if you go to see a physical therapist, these are likely some different tests and measures that you will be asked to do. So I just wanted to highlight these. I'm not going to read through them all, but you likely will have done these before or will be doing these if you go. And then also you may be asked to fill out one of these quality of life or patient reported outcome measures as well. And then Aryelle will wrap us up.
So key points is that exercise is safe and vital for individuals with neuromuscular disorders. Exercise is not curative, but it does serve to delay the disease progression and prevent other health complications. You must exercise with appropriate intensity levels. You can seek an exercise prescription from a physical therapist prior to engaging in exercise if you're not sure where to start. And then make sure to incorporate a combination of resistance training, stretching, aerobic, balance training, and aquatics when able. Those are our key points. We've got lots of references for you. And then we just wanted to include our contact information at the end of this presentation. So if you have any follow-up questions, we are always available via email and happy to act as a consult whenever.
Thank you both very much for your time and wonderful information. If anybody has questions, you can type them into the chat and we'll stay on for a minute to answer those questions. Next month, our session will be on September 5th, day after Labor Day at 5 o'clock. We're going to be having Jenny Schroeds, who is a dietitian with Ohio State, and she's going to be doing a cooking demonstration for healthy tailgating recipes coming into the fall for going into football season. So please join us in September for that session if you're able. And I don't see any questions right now, so we'll wrap things up. I appreciate everybody joining us this evening. And Aryelle and Andrea, thank you very much for your time and your expertise. And if you would share your slides with me, I can forward them on to all the participants so they'll have your contact information and resources and those great references that you shared in the presentation. So thank you both very much.
Perfect. Thank you. Sorry again about the technology difficulties and for keeping people over time.
It's okay. It happens. Thanks again.
Thank you.
Yep.
Okay. Bye.